The clitoris is a remarkable and often misunderstood organ, central to the experience of female sexual pleasure. While it is commonly depicted as a small external nub just above the vaginal opening, the clitoris is, in fact, much more extensive. Only the glans, which is about the size of a pea, is visible from the outside. However, beneath the surface, the clitoral anatomy branches deeply into the body, forming a complex structure that plays a crucial role in sexual arousal and orgasm. The entire clitoral structure measures up to 10 centimeters in length, with roots that extend internally on either side of the vaginal opening. These roots, known as the crura, anchor the clitoris to the pelvic bones, providing a stable base. Alongside the crura are the vestibular bulbs, which are also made of erectile tissue and flank the vaginal opening. When a woman becomes sexually aroused, blood flow to the clitoris increases, causing the glans, crura, and vestibular bulbs to swell and become more sensitive, much like the erectile response in the male penis. What truly sets the clitoris apart is its incredible concentration of nerve endings. With over 8,000 sensory nerve fibers, more than twice the number found in the head of the penis, the clitoris is the most sensitive structure in the female body. These nerves are primarily supplied by the dorsal nerve, a branch of the pudendal nerve, forming a dense and intricate network that can transmit intense sensations. This neurological richness is the primary reason why clitoral stimulation is the most reliable pathway to orgasm for most women. Yet, the clitoris is not the only structure involved in female sexual pleasure. The G-spot, another area of heightened sensitivity, lies on the anterior wall of the vagina, just a few centimeters in from the vaginal opening. Named after Dr. Ernst Grafenberg, the G-spot is associated with the urethral sponge and Skene's glands, sometimes referred to as the female prostate. When stimulated, the G-spot can elicit sensations distinct from those of external clitoral stimulation, though the degree of sensitivity varies dramatically from woman to woman. Some experience intense pleasure or even orgasm from G-spot stimulation, while others may not find it particularly sensitive at all. The experience of female orgasm is a complex interplay of physical and psychological processes. It begins with sexual arousal, during which the brain, the body's largest sex organ, becomes highly engaged. Sexual thoughts or physical stimulation trigger the release of neurotransmitters and hormones, including dopamine, oxytocin, and endorphins, all of which amplify pleasure and emotional connection. As arousal peaks, the pelvic floor muscles, uterus, and vaginal walls begin to contract rhythmically, usually at intervals of about 0.8 seconds. These contractions are involuntary and are accompanied by a rush of pleasurable sensations. For some women, orgasm is a single, intense climax, while others may experience multiple orgasms in succession, particularly if stimulation continues after the initial peak. One of the most notable differences between female and male orgasm lies in both the anatomy and the resulting physiological response. While male orgasm typically culminates in ejaculation and a subsequent refractory period, a temporary phase during which further arousal is difficult or impossible, female orgasm does not have a necessary connection to reproduction and is not always followed by a refractory period. This means that many women are capable of experiencing multiple orgasms during a single sexual encounter. Furthermore, female orgasm can be achieved through a variety of pathways. While clitoral stimulation remains the most common, some women find pleasure through vaginal, G-spot, or even anal stimulation. The variability in female sexual response highlights the importance of communication between partners and the need for exploration and patience. Understanding the anatomy and function of the clitoris and G-spot is not just a matter of scientific curiosity. It is a powerful tool for improving sexual health and well-being. Many women may not be aware of the full extent of their own anatomy, or may have internalized myths and misinformation that limit their ability to experience pleasure. By learning about the structures involved in sexual arousal and orgasm, women and their partners can communicate more effectively about their needs and preferences. This knowledge also has important implications for reproductive and sexual health. For instance, Recognizing the signs of sexual arousal and understanding what is normal for one's body can help women identify potential health concerns, such as changes in sensation, pain during intercourse, or other symptoms that warrant medical attention. Furthermore, a better understanding of female anatomy can empower women to make informed choices about contraception, sexual practices, and relationships. It is essential to recognize that sexual response is highly individual. What brings pleasure or orgasm to one person may not have the same effect on another. Factors such as emotional intimacy, mental health, past experiences, and cultural attitudes toward sexuality all play significant roles in shaping a person's sexual experience. Creating a supportive and non-judgmental environment is key to fostering sexual satisfaction and overall well-being. As our understanding of female sexual anatomy and response continues to evolve, it is important to challenge outdated beliefs and embrace a more nuanced, evidence-based perspective. Open conversations about sexual health, ongoing research, and comprehensive education can help dismantle taboos and empower women to take charge of their own sexual wellness. For those seeking further information or guidance, consulting a qualified healthcare provider is always recommended. Healthcare professionals can provide personalized advice, address concerns, and offer resources tailored to individual needs. In summary, the clitoris is a sophisticated organ that extends far beyond its visible tip, playing a central role in female sexual pleasure. Alongside the G-spot and other erogenous zones, it forms a network of sensitivity that can lead to deeply satisfying experiences of arousal and orgasm. By understanding the science behind female sexual response, women and their partners can foster greater communication, intimacy, and empowerment in their sexual lives.